Hi, I'm Dr. Alexandra Filangeri, registered dietitian, doctor of clinical nutrition, and I'm sitting here with world-renowned plastic surgeon
Dr. Thomas Romo, a plastic surgeon in New York City. I'm here to introduce you to our new podcast, We Got Your Number.
We are here to break down evidence-based information and real-world experience, and we're going to bring in some of the top experts in the world because
We got your number. How can we improve diabetes treatment in this country?
let's bring in experts and really talk about what supplements actually
Can
help.
we improve our sleep health by using these medications?
How much protein do people really need to
Can
eat?
nutrition solve all of our problems?
What happens if someone comes off their weight loss medications? Welcome back.
Welcome back to We've Got Your Number.
Today, we are going to talk about positive nitrogen balance, right? And we're going to talk about it in the context of healing from surgery and also in the context of muscle. So let's break it down, medical side of things. What do people need to know?
Well, nitrogen is an element. It's a very common one. It's most of our atmosphere is 70% nitrogen, so it's a gas and can be a solid. Nitrogen is used to make protein. It's one of the components of protein, and because it's unique, we can actually use the nitrogen balance as a measurement in the body of how your protein level is. So, and how do you do that? You check urine, because when we eat protein, we urinate nitrogen. You can measure that. If someone is in need in their body of nitrogen and you measure their urine and there's no nitrogen in it, you know that they're in need and you need to even crank it up. The body will, on its own, through the kidneys, will throw off the nitrogen that it doesn't need. And if you get a positive nitrogen balance, then that person is taking in plenty of nitrogen, so they're taking in plenty of protein.
What happens when a patient does not consume enough protein post-operatively from a surgeon perspective?
From a surgical perspective, we're always looking for outcomes. How do we improve the surgical healing process? Doing the surgery is a technical than the healing. So that tissue that makes you heal, people talk about scar tissue. We're talking about incision lines, but scar tissue, scars, and in fact protein. So it's not adipose fat tissue. It's not carbohydrate. It's protein, and you have to take protein in. And the data shows that if you take protein in prior to surgery, have somebody nutritionally in good health, and after surgery, it improves outcomes, decreases postoperative infections, reduces hospital stays. And so it's critical. And if your body's not taking that protein in, then it's going to steal it from your own body. And where do we have our protein? In our muscles. So if you don't take that protein in when you're healing post-op, and most patients don't feel like eating after surgery. They're kind of, I don't really want to eat, particularly elective cosmetic surgery. They don't want to eat. And then the protein is going to get stolen from their muscles. So that's critical for nutritional intake to improve surgical outcomes. That's your expertise.
Yeah. So I want to talk about the journey of protein in our body and essentially how do we obtain a positive nitrogen balance.
Well, you know that backwards and forwards.
So, I mean, the first piece that I want to talk about, and this is something that we have seen and we've even seen it in the media, is how much protein is enough.
Correct.
And I'm going to start with the standard, and then I'm going to, of course, shake things up a little bit. So right now, the RDA, the recommended dietary allowance, is 0.8 grams per kilogram body weight, right? If you want to know your weight in kilograms, you convert from pounds to kilograms, it's around 2.2. Now, 0.8 grams per kilogram is the amount we know not to cause protein deficiency, right? So we're not saying that this is the high end. We're not saying that this is the high end for somebody that is post-operatively trying to heal. This is not the high end for someone that is trying to gain muscle mass. This is not the high end for somebody at risk that is frail, elderly with sarcopenia. This is the baseline, right? There's a lot of criticism around the 0.8 grams per kilogram, saying it's not high enough. And what I like to say is, yes, it's not high enough, but once you start looking at the literature in different areas, like, for example, muscle building, muscle mass preservation, healing from surgery, disease-specific guidelines, you can get a little bit closer in the context of let's say a generally healthy person healing from a either elective or non-elective surgery will typically use a protein amount, and it really is individualized to the person. So I'm going to give a estimate between 1 gram per kilogram, and depending on how hypercatabolic or how much protein is required for not, to not have breakdown or inflammation, it can go all the way up to 1.6, 1.8 grams per kilogram. Where does a nutrition professional come in? If I were to say, Dr. Romo, I would like you to go home and consume 1.7 grams per kilogram of your body weight for the next 3 weeks, what would you say? And you are a, right, extremely brilliant physician. How do you get 1.8 grams per kilogram protein out of your food?
Well, luckily I know you, so I can call you and get the instructions how to do it, or read it off a can somewhere. But that's why we're talking about this. This is critical, and of course it dovetails into, as people are losing weight with the GLP-1s.
Yeah.
This is important information.
Understanding an individual's protein requirement. Now, the secondary piece is understanding protein requirements. Let's talk about nitrogen balance again. What happens to protein when we eat it? We eat proteins, right? Whole proteins, if it's animal protein from food, chicken, turkey, fish, beef, so on, plant-based proteins, which we'll talk more about, tofu, beans, tempeh, protein powders, and protein supplements, right? We take these things in dietarily, right? They start as whole proteins. They make their way through the digestive tract where they break down via digestion to single amino acids. The amino acids absorb into the bloodstream where they have 3 fates. And we spoke about one of them. The first is synthesis, right? It's going to be used for muscle building or building in general. The second is any nitrogen containing compound in the body requires dietary nitrogen, which is protein. And then the third with protein is we can use them for a topic called gluconeogenesis, right? So we are going to turn our protein into glucose if needed. Now, if we're turning protein into glucose, that's because we are not taking in enough other dietary sources of carbohydrate, right? So can you heal if you are now turning your protein into glucose? No, your body's going to favor, pumping your heart and your lungs and your immune system. It's not going to favor protein building.
Because the body is actually running off of glucose.
Right.
Yeah, that's why. So if it needs it, it's going to take your protein and turn it into glucose. So because your brain and your body needs that energy source.
Right. So when we are thinking about protein, right, we have something called an amino acid pool, meaning that it's not just I take in 60 grams of protein a day, I use 60 grams of protein. Intracellularly, inside of our cells, we store proteins. Why? Like you talked about in healing, there's protein turnover. We are breaking and synthesizing all day long. Around actually 300 to 600 grams of protein are being exchanged in our body throughout the day. So if we're healing post-operatively, we need to make sure we have positive nitrogen balance. So if I'm not taking in protein, high amounts of protein, where is the protein that I do have going? It's going to nitrogen-containing molecules. It's being converted into carbohydrates for energy. It's going to support basic body functions, right? When we're supporting basic body functions, we don't prioritize building and healing.
Correct. Well, and that's why knowing about this is so critical, because eventually everybody's going to have surgery. And we want it to be successful. It doesn't have to be, in my field, elective cosmetic surgery or reconstructive surgery even. We're going to end up having surgery. And this topic will come up as we go through our wonderful podcast. We got your number.
So the takeaway from today's mini session is 1, protein's important. And 2 is you need to learn your individualized needs. 1, if it's surgery. 2, if it's healing. And 3, if it's weight loss.
Correct.
So thank you for joining in on today's number, Dr. Romo.
Allie, thank you very much. Dr. Phil and Jerry.
We got your number.
We got your number.